My name is Dr. Harshal Agrawal. I'm a pediatric neurosurgeon and an epilepsy surgeon in Mumbai. Today, I'm going to talk about the surgical options for epilepsy and how they can be a life-changing option. Epilepsy is a condition that is characterized by repeated seizures, which can greatly affect a person's daily life. While medicines help many patients, about one-third of them continue to have seizures despite treatment. For these patients, surgery can be a life-changing option. Today, I will discuss how surgical options can be used for treatment of epilepsy and help families and patients to understand when and why epilepsy surgery should be considered. Epilepsy is a neurological disorder characterized by recurrent seizures caused by abnormal electrical activity in the brain. It can affect patients of all ages and can lead to significant physical, social, and emotional challenges. In some cases, the seizures can be debilitating and even life-threatening. Epilepsy affects approximately 50 million people worldwide, making it one of the most common neurological disorders. About 30% of the patients continue to have seizures despite adequate treatment with medications. Frequent seizures can be debilitating and interfere with the patient's activities of daily life. They may affect his education and employment. The patient or the families may suffer social stigma because of the seizures, and they may suffer from other mental health disorders like anxiety and depression. It also adds to the financial burden on the families. Drug refractory or drug resistant epilepsy is a condition where seizures persist despite trying two appropriate anti-seizure medication. This condition arises in at least one-third of the patients treated with medications and are potential candidates for surgical treatment. When is surgery considered in epilepsy? Surgery is considered when a patient is suffering from seizures which are frequent and disabling. Medications have been tried and they have failed to control the seizures, and tests have shown that the seizures are arising from a specific part of the brain which can be removed safely surgically without affecting the patient's vital functions. Delaying surgery can cause further brain damage due to repeated seizures. Studies have shown that early surgery improves long-term seizure control, cognitive function, and quality of life. Various surgical options exist for epilepsy surgery. The most common is resective surgery, where a part of the brain where the seizure is arising from is removed surgically. For example, a temporal lobectomy. Other surgeries include corpus callosotomy, where the connection between the two parts of the brain is disconnected surgically so that the seizure spread is limited. Additionally, devices can be implanted into the brain or onto the vagus nerve called as deep brain stimulation or vagal nerve stimulation respectively to help neuromodulate seizures in patients who are not surgical candidates for open surgery. Epilepsy surgery is performed by a trained epilepsy surgeon. All epilepsy cases should be discussed in a comprehensive epilepsy surgery program where a neurologist, a neuroradiologist, a neurosurgeon, and other members of the team are present, and they discuss the case completely, and then they decide that the patient will benefit from surgery. Subsequently, the patient and his family is counseled about the outcomes of the surgery and the potential complications, and once the consent is obtained, we proceed with the epilepsy surgery. The surgery is usually performed under general anesthesia. However, in certain cases where we might have to do language mapping or brain mapping, awake surgery may be considered. Advanced brain imaging like MRI with EEG, PET scan, MEG scan can be performed to help localize the seizure focus. The post-surgical phase usually requires medical adjustments, speech, physical, and occupational therapy if required, and regular follow-ups for monitoring progress. Success depends upon the type of surgery performed. A temporal lobectomy can lead to 80% seizure freedom rate. Other surgeries significantly reduce seizures and help in improving the quality of life. Benefits of surgery include better seizure freedom and control of seizures, reduction in the number and dosage of medications, improvement in cognitive function and social life, increase in ability to work, study, and carry out activities of daily life. Modern surgical techniques have made epilepsy surgery safer with minimal complications. Risks include infection, bleeding, and neurological deficits, but these are rare in experienced hands. We should discuss the risks, benefits, and success rates with an epilepsy specialist. Surgery can be a life-changing decision, offering a chance of independence and a seizure-free life. For patients with drug refractory epilepsy, surgery is a highly effective treatment option that can significantly improve the quality of life. Early evaluation for surgical options can help prevent years of uncontrolled seizures and their devastating consequences.